Hi, my name is Izzati binti Adam Shukri. My matrix number is P440010. Today I want to make a presentation about musculoskeletal disorder, osteoporosis. First, what is osteoporosis? Osteoporosis is a long-term bone disease that causes the bone to become weak, thin, and fragile. This happens when the body loses too much bone mass or does not make enough new bone. As a result, the bones become less dense and can break more easily even after a minor fall or injury. Osteoporosis usually develops slowly over time and often has no early symptom. Many people only realize they have osteoporosis after experiencing a bone fracture. This condition is more common in older adults, especially post-menopause women. Number 2, real patient case introduction, Yulia Petrakakis. For this case study, I selected a real patient story shared by the International Osteoporosis Foundation, IOF. The patient name is Yulia Petrakakis, and her case was published as part of a public osteoporosis awareness campaign. This case was chosen because it is a real and reliable patient experience that clearly shows how osteoporosis can affect daily life. Her story also explains the importance of early diagnosis, proper treatment, and long-term disease management. This real case helps us understand the physical and emotional impact of osteoporosis on a patient. Number 3, how and when she was diagnosed. Yulia Petrakakis first became aware of her bone health condition at the age of 44 years old. At that time, she underwent a bone mineral density (BMD) test to check the strength of her bones. The results show that she has osteopenia, which is an early stage of bone loss before osteoporosis develops. Over time, her bone condition became worse and she experienced repeated fracture. After further medical evaluation and continued bone loss, she was diagnosed with osteoporosis. Her diagnosis showed that osteoporosis can develop silently and worsen over time if not managed early. Number 4, treatment plan and medication. After being diagnosed, Yulia began long-term treatment to manage her osteoporosis and reduce further bone damage. Her treatment plan includes regular bone mineral density monitoring to check her bone health over time. She was advised to take calcium and vitamin D supplement to help support and strengthen her bone. She also received osteoporosis medications such as bisphosphonates, which helps slow down bone loss and reduce fracture risk. In addition, lifestyle change such as regular physical activity, healthy nutrition, and fall prevention were important part of her treatment. Physical rehabilitation and careful daily movement were also necessary to improve her mobility and prevent injury. Number 5, patient's condition before and after treatment. For the before treatment, before receiving proper treatment, Yulia experienced repeated bone fracture due to weak and fragile bone. Then her bone strength gradually decreased, making her more vulnerable to injury even from minor movement or falls. She also experienced pain, discomfort, and difficulty performing normal daily activity. Her mobility became more limited and physical movement became more challenging. The repeated fracture affect both her physical health and her quality of life. Her condition before treatment show how serious osteoporosis can become when bone loss is not controlled early. After starting treatment and managing her condition, Yulia became more aware of her bone health and physically limitation. She learned how to take better care of her condition through medication monitoring and lifestyle adjustment. Her risk of future fracture was reduced with proper treatment and preventative care. She became more careful in her daily activity to avoid falls and protect her bones. Her mobility and daily functioning improved with better disease management and rehabilitation support. Although osteoporosis cannot be completely cured, her quality of life improved with long-term treatment and self-care. Number 6. Conclusion. Osteoporosis is a serious musculoskeletal disorder that causes bone to become weak and fragile. This condition often develops slowly and may not show symptoms until a fracture happens. Yulia's case shows that osteoporosis can significantly affect a person's physical health, movement, and daily life. However, early diagnosis and proper treatment can help reduce complications and improve quality of life. This case also highlights the importance of long-term management, prevention, and patient awareness. Osteoporosis may be silent, but with early action, its effect can be better controlled. 7. Osteoporosis awareness. Osteoporosis is known as a silent disease because it often develops without clear warning signs. Many people only discover they have osteoporosis after suffering a fracture. Early screening and bone health assessment are important, especially for older adults and women at higher risk. Taking enough calcium and vitamin D is important to maintain strong and healthy bone. Regular exercise, especially weight-bearing exercise, can help improve bone strength and balance. Raising awareness about osteoporosis is important to encourage prevention, early diagnosis, and better long-term bone health. And that's all from me. Thank you for watching. Bye!